So I work in mostly the cancer space, but I also have the privilege, the ability to see from the government side. My husband is the governor of one of the most western states of Nigeria, and this allows me to interact with a lot of issues that women at the grassroots level have. So my role here would be to give you that perspective from a low middle income country, what happens at the grassroots level. We have a lot of investors in the room that our Honorable Minister has already spoken and put together what the picture looks like. But for us in the States, there's also a very big issue which has to do with access to care. We're dealing with issues of insecurity, poor knowledge, and then, of course, the problem of funding. We don't like to talk about funding, but funding is a very major issue when it comes to the ability of our women to access the care that they need. My work is mostly, my foundation focuses on cancer. The commonest cancers in Nigeria are breast, cervical, and then prostate cancer as well. We have an upsurge in childhood cancers where we see a very wide inequity in outcomes despite the ability to cure the diseases. However, we have been able to put together a model state in Kebbi, because my state is called Kebbi State, and working with the government, a lot of the types of partnerships that have been mentioned by Dr. John and everyone else, we operate on a local level. What do I mean by that? We work with the community, such as the traditional and religious rulers, to get our program, whether it's PEPFAR, whether it's USAID or the national government program, to be accepted. We work with the community gatekeepers so that they can explain to the women new vaccine introduction. We've been able to carry out a pilot of HPV. Nigeria is one of the countries that is yet to start HPV vaccination for the prevention of cervical cancer. So by working with those institutions, we were able to carry out a reasonable pilot, which we published. And this has shown us that there is acceptability if it's available. So the issue is availability. And what is causing the lack of availability is funding. We can do the awareness, we can do the delivery, but for the government to be able to reach those people, it needs a large amount of funding. Nigeria is a massive country, 230 million. So my state is about and I don't mean this disrespectfully, is the size of some African countries, and we have to deal with that reality. What the state government did was to start an indigent cancer fund, which also included like an informal blended finance that includes philanthropic donations, that includes partners, that includes the donor programs that are going on. The USA, the Limited Success Program is currently running in my state, but it was funded only to 10 local government areas. We have 21 local government areas. So with partnership with WHO, they were able to take care of the training, and then with partnership from the state government itself, they provided a counterpart funding, and it was extended to the entire state. So we're now able to screen and provide early treatment for cervical cancer. My foundation, which is the Medical Cancer Foundation, recently announced we launched a new cancer fund, which is 50 million naira. With the extreme rates that we're talking about, it doesn't come up too much. But what we've been able to do over the years with 750 million naira is has impacted over 500 cancer patients directly. So we have this large pool of cancer patients. Some are still dealing with the disease, but a lot of them are managing to survive. Although we do see cancers in very late stages in Nigeria, very, very late stages, they come, and really what we're supposed to offer them is palliative care. I also sit on the board of the UICC. I'm a third-term director, and talking about women in Africa in leadership positions. I recently ran for the presidency, but I didn't get it. For 89 years of existence, the UICC has not been able to produce an African president from the continent. Yet this is the continent that bears the greatest burden. And afterwards, when we were speaking to different stakeholders, it came down to an issue of funding. What programs can you fund my organization with, including the African organizations from the smaller countries? So my point here is for us to move forward and for us to create these workable, innovative finance vehicles, we must look at Africa in a different light. What can we bring to the table? We know that it's not funding. We know that with the exchange rate, it's going to be difficult. The environment is difficult, understanding the system and a conducive business environment that has been mentioned. There is political will in a lot of the areas. Definitely political will is not the problem in my state, but there are other things that Africa can bring to the table. So good partnerships, the seed fund can be provided, even if it doesn't cover everything. So I'm really pleased that we have a lot of female philanthropists that are willing to speak to us, and with the right champions at country, in country level, we can see a lot of difference.
Thank you so much for that.